就是每4个人里面有1个人去看那个家庭医师，就是因为是 social 的问题，不完全是因为他生病，所以他不管是因为比如说家里面人陪他讲话啊，或者是他有一些其他的状况，然后再来的话，那当然就是说，台湾为什么是国健署，其实是有道理，是因为现在三高的问题，其实是国健署要这样。那因为大家都认为社会处方签对于三高，其实如果你是早一点让他开始，不管是运动啊，或者是舒压，因为三高的问题不完全是跟吃有关，也跟你作息、跟你的心情有关，所以为了要解决更多三高的问题，所以他们也在做这个社会处方签也跟这个有关。那我们台湾现在开始，其实也是因为我们到了这个所谓的超高龄社会，那健保里面其实现在用他们其实英国一样，英国现在健保花钱花最多的跟我们一样是癌症。然后再来是三高，所以其实为什么社会处方签对于他们也是有必要性，也是因为希望可以降低这个健保的成本支出的问题。
And England isn't alone in that, so we see similar trends, and you say an aging population and so on, and a low birth rate. We see very similar trends in lots of other countries as well. So the concept of social prescribing isn't new, but the interest has grown significantly in recent years. But arguably, social prescribing has been happening for a very long time. And it exists in very local, small projects, all around the country, and in other countries, of course. It really is kind of centered around these wider determinants of health. So those will be like the social, economic, and environmental things that impact an individual's well-being. And as I said on the last slide, estimates suggest that 20% of patients that go to their GP in England aren't there for a clinical problem, with their body or their mind. It's a social problem.
Yeah, so just share with you that in Taiwan we don't have the GP system. So it's interesting. So all these have the social issue. We call it hospital shopping.
Okay.
They actually approach any doctor's hospital clinic by themselves.
Wow.
Some
so
of
it's
them
even more of a problem.
Yeah. So they the cost. So because we don't have the GP system.
So people would go to their first point for like. What would be primary care instead of primary care?
No, so we don't have that. So the interesting part is to say, let's say before COVID, especially before COVID, is that many if you go to any hospital, it's all senior citizens and they're waiting in line for that because they go there to meet friends.
Yeah.
And then when you go to the doctors, then you have someone to talk to take care of you. So that's caused a huge problem in Taiwan. Definitely COVID time it reduced, and then after COVID is again. So that's the big problem of Taiwan's national health insurance problem is you always increase the budget is very hard to control.
You need social prescribing.
Yeah.
So in England, one of the big turning points for social prescribing was around the government's loneliness strategy. And I know that Japan and South Korea and lots of countries, have used the loneliness kind of strategy and all that work to hook social prescribing into it.
Yeah, but one thing I just want to confirm that the loneliness doesn't mean for the senior citizen only, right? It is absolutely like even including currently we talk about the children and the young people, correct? Because it's the same in Japan. Also,所以英国是全世界第一个成立孤独部，就是解决孤独问题的国家部会。那现在是日本确定也有，然后他刚才讲另外一个国家，我不太确定是不是韩国，但是我们台湾现在是还没有。我们现在都认为只有独居老人，可是所以我刚刚才有跟他确认，因为就我了解，英国跟日本在成立孤独部不是只为了老人，因为现在青少年的问题其实是更严重的。那他说对，他们其实不是为了老人，他们其实也是在解决青少年儿童的问题，尤其是现在在手机网络成瘾时代的话，其实他们的问题更严重。对，所以就先给大家补充一下资料这样。But when did this the only
So
strategy being set up
this was just before 2019, so like early 2019.
before COVID, right?
Yeah, before COVID.
所以是在2019年的时候，他们有这个政策。
And then the next kind of thing that happened was the NHS long-term plan.
Yeah.
So, and that was in 2019, and that was when they rolled out social prescribing so that everybody in the UK had access to a social prescribing link worker. And it was all about, they've circled it in orange, orange. It's boosting out of hospital care. Redesigning and reducing the pressure on emergency hospital services, and a more personalised care. So, having longer with the patient, giving them a more personal approach, and a focus on population health. So all things that feel good for Grace.
Yeah, I have one question for you, but just let me translate over first. 所以其实他们英国，因为英国是家庭医师制度。然后他们在2012年的时候其实有修法，然后当时是让家庭医师可以分配他们那一区的健保预算，所以变成是说当时所有的医院都要去跟家庭医师争取说你把你的病人送到我的医院来看诊，结果就变成是说其实他们英国其实很早，他们的类似我们现在长照3.0是很早很早以前就在推，但是因为家庭医师可以分配那个预算是给哪一家医院。所以造成他们当时的社区照护其实需要有医院跟社福机构一起做合作，都一直合作不起来，因为分配那个预算的其实是家庭医师。然后他们为了要解决这个问题，所以在2019年的时候，他们就推出了这个改革，叫 NHS Long-Term Plan。那这个 plan 其实推出来没多久就碰到疫情，所以他等一下会讲有另外一个2022年的法案。就是因为疫情的时候呢，终于打破他们本来医疗机构彼此之间不合作的问题，也不跟社福机构合作的问题。那因为疫情打破，所以他们2019年这个出来，刚好2020年疫情来，反而就去实施了这个政策本来要改革的最大的目标。所以2022年他们后来就修法，所以等一下他应该会有机会谈到2022年的法。那但是在2019年这边就出了一个，就是我们这一次来最主要学习是今天要跟他们请教的一个叫做 link worker 制度。那什么叫 link worker 呢？就很像我们今天早上不是去 Stripe， 那 Stripe 刚刚有在问他说那是谁推荐？因为他们都要透过 GP 嘛，那谁推荐去跟 GP 讲说，你们 Stripe 有在针对 mental health 或一些老人做这些？他说他们 Stripe 有一个专门的员工去。那附近的家庭医师跟社区去讲说，介绍 Stripe 是谁，可以做什么服务，所以他们有点是去推销他们的服务，然后欢迎他们来使用。那这样子，他们等于是 Stripe 自己有一个人专责做这件事情，可是不是每个非营利组织都有这样的人力，所以这个 link worker 这个制度就有一点是 between GP 医院或社区，他有一个人去做刚刚这样的连接。那这一次来英国最大的制度就是想要学习他们 link worker 到底怎么设计。Okay, so no problem. So while you are setting the computer, I actually have one question. Is because I actually do some research about your 2019 and your 2022. That is a law. This is a plan. But to be honest, it is not very obvious from my point of view. This is where the link worker come from, because we definitely understand the needs between the community, the GP, the patients, and also the community like Stripes organization who provide these services to those needy. We got someone to link as a bridge. Yes, that's for sure. So this is mechanism makes sense. But according to this policy, and also I read part of the 2022, if you are going to explain that law, I actually couldn't find the link workers exactly in the policy, so I'm not sure if there's anything I'm missing. And also including the budget, because we actually care more about the budget issues, because in Taiwan we don't have so many charity programs for these most, how to say, Taiwanese people is very passionate about the big disasters. Yeah, so they will donate a lot of money for that disaster like that. But for this more like a long-term cares, and it's not well known. And most of the people they won't donate the money for this. So that's our problem, because we also ask Thrive the same things. How do you get your donations, right? And obviously they got many from big charity organization or others, but it's not in Taiwan. So we actually want to learn from you.
So So if I just skip ahead, so I will absolutely come to those points. So yeah, this is kind of, you've just explained this, but this was this was in the 19 plan, and it was the biggest investment in social prescribing by any national health system, and it legitimizes non-medical community-based activities alongside medical treatment. So it's not instead of, it's alongside medical treatment as part of this personalized care approach. So that was a really huge shift in the thinking of these health leaders and health commissioners.
Yeah, not just that using the current medical services product to think something strategy that different, right?
Yeah, exactly. So that was quite important, just in that shift in you know, accepting what kind of could be considered important for health. I will come to your questions, but I'll weave them in. I'll weave them in.
Yes.
So alongside that investment into social prescribing in the NHS, separately we were set up as an independent charity in 2019. So we were set up by the Department for Health and Social Care, and we, as I'm sure you'll know, we do all things to support social prescribing. So that is detailed in those 5 points. So we connect different parts of the system, so the health system and community sector and all the different kind of, you know, I know you're interested in green social prescribing, all of those different parts. We look at lots of innovation and with these partners, and we encourage like investment into all of those different partners. And I know you just mentioned that, how we're funding those activities and those community groups. We've done a lot around the evidence base, so working with academics to make sure we've got the right evidence that commissioners and politicians are saying they need to pay for this work, and then raising awareness. So that's with the public, but that's also with clinicians, you know, making sure that our GPs are receptive to it and they're on board, so that they're referring people, and making sure that you know, everyone involved, whether that's politicians or the receptionists in hospitals, you know, everyone has to kind of understand social prescribing and get on board with it. So that's a big part of what we do. So this is and I feel like you guys have a bit of an understanding about the kind of
so I just want to confirm first is in 2019 this national academy actually was sponsored or set up by the Secretary of the State for Health and Social Care, right? But after that, they still continue to funding this operation annually.
Yeah. Right? So the idea was that we would be funded on the first round of funding, they gave us funding for 2 years, and then it was for a year, and they kept extending it by a year and a year and a year. But the idea is always that it was tapered and that we would become financially independent.
So far still
we are now, I think we're like 30% funded by Department for Health.
Okay, so 70% actually you are prepared.
Yeah, so we do a lot of, that's been a really big shift in the last few years, is making sure, because they always said, you know, we can't fund you forever, you've got to survive by yourself. So we've done a lot of work to
Okay, yeah, let me get到了。所以他们其实在成立的应该至少是，它是19年成立嘛，前2年就是刚刚讲的，他们类似我们的国健署就先出了2年钱，然后后来又因为后来碰到疫情嘛，又再给了大概2年钱。那但是从去年开始，国健署他们的国健署就跟他们说，他不会一直给他们钱，所以他们说他们目前今年只有30%是国健署给的，70%其实他们是想办法募款募来的，所以他们有被要求要自给自足，就是他们的国健署没有要继续support 他们。那他们的工作就是刚刚不是有讲了好几个，包含这 awareness 啊，然后跟医院啊，还有跟 community 联络，都是他们在做的。所以等一下我当然会问他现在的70%钱从哪里来啦？对，但是这个是可以。那还有另外一个可能要让大家知道，就是说，因为英国在1980年代，他们有类似像台湾龙发堂那样的制度，其实是那时候就是出事了，就像我们那个龙发堂出事了。所以他们的政府就被 民间舆论要求，就是那个要把机构那样大机构解散，他回到社区去照顾这些精神病患。可是你也知道，回到就跟台湾现在也是在讲嘛，就是应该要回到社区来，其实会有社区要如何接收这些人的问题，所以他们也是一直都没有。所以他们那个时候有成立了一个比较特别的社区中心，就是要解决这样的问题。可是后来我觉得刚才讲，因为他们的居住制度，造成机构跟机构之间合作困难，所以当大家在了解为什么英国或者社会处方签的时候，可能要先想，它不是要解决的是我们现在讲的长照或失智的问题，他们其实要先解决的是刚刚原来在讲那个精神病患回到社区刚开始的早期。当然现在也因为三高问题跟刚刚讲的孤独感问题，所以现在变成他们的 social prescribing 变成是主要政策，因为这样子健保的钱才不会无限膨胀，因为他们跟我们一样，健保也不希望无限膨胀。对，所以他也是说，所以这个是他要先解释，所以这样等一下你在听他在讲什么是 link worker 或者是怎么做连结的时候，你会去比较理解他们为什么要设计这样的制度。OK。
So this is a diagram that shows the social prescribing journey, and it's luckily got an older person, but you know, it's not
always like this.
Yeah, exactly. Although lots of countries do focus on older people, so that's a very, very common thing that we see in other countries. They are focused on specific populations. So, let's call her Mrs. Smith. Mrs. Smith goes to see her primary healthcare provider in England. That's her GP. They identify that she has an unmet social need, you know, something that isn't a physical or mental health problem. They refer her to the link worker, so this is the really key bit. And that link worker has much longer with her, so they have an hour's appointment rather than 10 minutes. And they will co-produce a plan with her, a personalised care plan. So it's really important that they're working together on that plan. You know, she's not being written out a prescription like a doctor normally would. They're producing it together, collaboratively, and that would be done over a course of multiple appointments with the link worker. So they might see, they would see each other multiple times, and then the next referral is out into the community voluntary sector. So they would identify what matters to Mrs. Smith and what type of support or service that sits in the community could benefit her, and they would refer her out to those services.
Okay, so I actually used the previous slide to a little bit more like a training our Taipei Medical University's hospital, affiliate hospitals.
Okay.
So many doctors ask me one question which I cannot answer is about link worker. So do they need to have any medical background? For example, they used to be the nurse or social welfare workers. And then how do they be called by link worker? Is there any certification? Later on, I know there is some kind of like certificate or training. So I think that is the most popular question being asked whenever I talk about the social prescribing and link workers in Taiwan. That is a frequent question being asked.
Okay.
Yeah.
We hear that question a lot, and that's a very, very good question. So, so link workers are non-qualified, non-clinical staff. They have basic training in social prescribing, so anyone can be a link worker. The core competencies are based around things like being empathetic, a good listener, being proactive, and being able to manage safeguarding. So those are the kind of core competencies that are involved. They have to have a background in something similar, so you know, or have a CV that demonstrates some kind of suitability to the role. So it might be in supporting people in any kind of health, social, community services, but they don't have to have a clinical background. And there aren't any formal qualifications. It's like a basic GCSEs in English and maths. I think so very low level qualifications.
So they don't need to have like any experience as a social worker?
No. So lots of countries do upskill existing social care workers.
Yeah, to be the link worker.
Exactly.
Right?
Yeah. So different countries take different approaches, and that is based on what their healthcare system looks like, and where there's resource and funding available, and where there's kind of space to upskill. So in the UK and in Canada and in lots of countries, we have introduced a new role, and that's a new linked worker role. Lots of countries have upskilled existing roles instead. So a social worker in England is much more about safeguarding. So it's a slightly different role. It's not really as much about like health and well-being. It's more about safeguarding and social services and those types of things. But lots of countries that have a slightly different social worker type role actually might upskill them instead.
Yeah, so why I ask you these questions, because again the doctors ask, because in Taiwan we have two systems. One is social workers, which means they care more about the people, like maybe because of poverty or some social other issues. So for example, we have a lot of children or teenagers drop out of school. It is because of the family issue or other social issue. It's not because of mental health. So in Taiwan, there is the social workers that will be in charge of this together with the school. And on the outside, we also have the other system of like inside of hospitals. For example, one of my friends, a doctor, he actually specialized in dementia. And then he actually organized a community with all these senior citizens plus their family taking care of the dementia patients, right? And so to them, he actually hiring at least one, I believe there's more than one, used to be a nurse, but she decided not to be a nurse anymore. So she actually now it is full-time dedicated to support this dementia community. And but because she was trained as a nurse and she also been trained as a follow-up with all these patients status, you got to be trained. So she actually is a qualified 我不太确定各管师的英文怎么讲。So she actually is a qualified
manager.
Yeah, like a project manager, but for the patient control, status control. So we do have these two systems. So that's why in Taiwan, the doctors keep asking me, is the link worker need to be a social worker background because they is from the poverty or like a social issue points, or like the most of our project management. Like the best manager in the hospital or nurse transfer, they want to be, not so like a clinic, so they move to that role. So that's why they ask.
So that is, we see that a lot as well. So there's often lots of people that might have been a nurse or might have been in another kind of clinical role, maybe like an occupational therapist or that kind of a role, and then they go into being a link worker. So lots of people, that would
but
be
it's not necessary. It's not
absolutely not. No.
Yeah.
And that is something that comes up. Does there need to be some kind of qualification, and therefore that will give that will be of benefit to the role and to retention, because we have a big issue in England with link worker retention. So people leave the role quickly because it's very stressful. They have high work, high caseloads.
Are they being paid by the government?
So they're paid through the NHS.
Okay. So NHS actually pay for them by case or by.
No, by salary. And
so that's why the more case they have, and actually it is high pressure. I understand. Okay, let me translate that. 所以我刚才在问的，其实就是因为我每次在台湾讲这个，每个人都在问我说，那难道不需要有，比如说是医院的个管师，以前通常都是护理背景或者是社工来当 link worker？那他说他们这里是没有这样的要求。那但是我们台湾我最常被问到的都是为什么不是这两个？那他有说有的国家是把社工训练起来做link worker。那等一下可以问他是哪个国家，但他们是这里没有要求是护理背景或者社工。然后另外一个是刚刚问的，他说他们的健保署是付link worker钱，是月薪，可是因为他说现在link worker因为要接的案子量太大，所以那薪水又不是很好，所以很多人就离职。 很多人就不做，所以就是说，虽然他没有要求一定要具备那些执照，可是可能工作量很大，所以就会变成就是离职率变高。那我先说，我去年6月的时候，我听到的那个英国学者是说，去年6月之前，他确定全英国有2000名 link worker， 然后他说到2030年，他们英国的政策是要9000名，这个是去年他跟我说。那等一下我也可以跟他确认这个数字，这样子。对，所以它不是只有几百个。我先说，其实在去年6月我听到演讲的时候就已经有2000。
Okay. So yeah, it just says at the top that yeah they're funded through the GP contract, and sometimes sometimes the NHS might commission a link worker service that sits in the voluntary sector. So the health sector might commission the community sector to deliver the link worker role. So it's a mixed picture.
So which means that the charity sector also can pay the link workers to do the job.
Yeah. So So sometimes we see also like there's a real mix. So most link workers are funded through the health service, but there's also some link workers funded through like local libraries or local authorities like councils, or community centres, or specific charities that work with specific conditions. So like a dementia charity might fund a link worker, or a charity that works with like LGBTQ people, they might fund a link worker in a specific town where there's lots of populations.
So make sure I understand that the money actually comes from GP, right? The GP contract. Even though the budget after that is NHS, but actually it is come from the GP's pocket. No, I mean the GP's.
No. So it comes from like I guess central government to the Department for Health, to the NHS, to the GP contract, and then.
And so the GP contract, but is all the GPs actually will pay for the link workers or no?
It's in the GP contract that they have to have a link worker.
Oh, I see. So if they don't have the link worker, then they won't get the GP contract. Is that the case?
They just. I don't know what happens if they break the contract, but they have to in the GP contract, which is like mandated by Department for Health. They have to have one link worker per. I can't remember how many. It's like 20,000 patients or something. So for every 20,000 patients, they have to have a certain amount of link workers.
好，所以其实就是他们，因为他们是公益制度嘛，所以他就跟我们一样，我们要跟健保局签约才能够变成有健保的那个。但是他们说他们是在 GP 的合约里面有要求说，好像他现在不确定正确的数字啊，但是可能就是说你每有2万名病患的 GP 就是家庭医师，就是家庭医师就要有一个 link worker。所以那个 link worker 的薪水，刚刚我们讲的那个，就是要给 GP 按照合约上，他是要请这个人，他才能够拿到健保署的健保合约啦。对，所以当然那个 GP 的钱，就像我们所有有看健保的钱，还是从健保署来的啦。但是有一点就是中央编预算给健保署，健保署再拨钱到，就像我们现在医院啊、诊所或什么。那现在只是他这边有要求说，如果你要是变成我的。就是公医的 GP 的话，那你按照合约里面，你每2万个病人，你就一定有超过2万个病人以上的 GP 就要有一个link worker了。对，因为你要记得，就是英国看病一定要你要先去 GP 认为说你可以再往下走，不管你是要去大医院或小医院或诊所，他要指定完你才能去，你不能自己就跑去大医院看病，他们不收的。所以 GP 的权利是很大的，可是也是因为这样，他们很多健保的钱是直接都给到 GP 的，就是家庭医师这边。
So yeah, it says on the second point down there, it's a contractual requirement for GPs to offer social work. And something that we do at NASP is fight very hard that stipulation remains in the GP contract. So I think every 5 years the GP contract is reviewed by the Department for Health and NHS England, and we have to make sure every time it's reviewed that it stays in there, because otherwise there will be far fewer link workers because they don't have to.
Yeah.
So it's important that stays there. And then just at the bottom, it says there's no strict definition on who can benefit from social prescribing, and this isn't defined anywhere, but these are the groups of people that we know can benefit really significantly. So if you have one or more long-term condition, if you have a mental health problem, if you are lonely or isolated, and if you have complex social needs, so if you have financial stresses and debt and things like that. So what do link workers do? As I mentioned before, they have a very long appointment time, so they have 6 to 12 contacts over a 3-month period. And that means that they can give people time and build a relationship and really ask that all-important question, which is what matters to you. As I said, they co-produce that plan with that person, and then they connect people to community groups and statutory services. And another really key part of the link worker's role is to collaborate with local partners in the community. So for them to be able to effectively refer people to these activities, they need to know what's there. They need to be well informed about the services and the support in the community so that they can refer people. So part of their role as a time proportion, I think it's like 10% of their week is meant to be spent doing community development and getting out physically into the community and going to the local church and saying, do you have any activities that you offer? What time are they? Who can come? Do they have to pay? All of those questions, so that then when Mrs. Smith comes through their door and she says, oh, I used to go to the church but it closed and I really want to find a new community, it would be so lovely, she knows, well I know that there's one on this corner, they have a group on this time, you can go along. So yeah, the other thing to mention on this slide is that their typical caseload is 250 people.
Annually?
Yeah. But we see that is very, very rarely the case. It's normally 3 to 4 times that. So it's a big issue for us at the moment, is the pressure that's on link workers.
So which means the 250 people divorce is set by the policy or by the law?
It's not set, it was just a guideline.
Oh, okay.
Yeah.
So which means the fact it is actually, the demand is higher than the guideline.
Yeah. So it's positive in some ways because it shows that that social prescribing is working and it's good, and doctors like it and patients like it. They want to have a social prescription, but it means the pressure is too high on link workers.
好，我刚才问了，就是他现在上面写的那250人，其实是他们的指引，社会就是有一点是这个是社会处方签指引里面说认为，但是实际上需求量是3到4倍啦。所以他刚刚我不是有说林国可现在流动率很高，就是因为他本来来的时候认为他1年最多收250件，结果现在是3到4倍的量，就是750到1000件，你根本做不完。而且刚刚我不晓得大家有没有听到一句，就是说他不是只负责跟病人哦，他还要去，就像我们今天早上去那个见面的那个 Stripe， 他要去教堂，他要去到处都还要分散到社区去说你们有哪些组织会提供这样的服务，要钱不要钱，然后你是每个礼拜几他可以来，他们要做记录，所以这样当有病人有需求的时候，他才可以说，那你现在可以到这个非营利组织可以去做什么，所以他们很忙啊。就是他又要跟病人聊，他又要去跟社区聊，而且你那个聊天都需要时间，对，又不是什么做个 AI 就可以解决的，所以做不完的。对，而且你也知道，有的病人一坐下来，他就是要跟你聊天聊不完的，那你后面的病人都不用接，对对，所以这个是他们目前最大的问题会在这里。
I just realised it's probably very loud for your colleague down there. Shall I turn it off or is it okay?
Okay.
Okay, it should be okay. Yeah, they like cold with
Okay.
cold air conditioning. Yeah.
Okay, so a typical social prescription, it's so varied, there's so many. In England we have 170,000 registered charities, so there's so many different activities and community groups that you can be referred to. And you know, there's a really large range of types of services as well, so sometimes they might be like public and statutory services, like things like citizens advice, if you have financial or debt, if you need financial or debt advice, employment support, that type of thing. This is a little bit of a technical slide, but I think it might be useful for me to just quickly explain it.
Okay.
Because it's about where the link workers sit. So the PCN means primary care network. So this is where the question comes from our recent link worker survey. So we sent out a survey to understand what social prescribing looks like. And we asked them who employed them, where were they, where did they sit? So 54% sit in are paid through the GP contract.
Okay.
24% are paid in the community. The VCSE stands for like the voluntary community charity social sector. Another 8% is paid for GP Federation, so it's slightly different to the this, but it's still health. It's a different type of contract, but it's still health. Again, 3% by the NHS Trust, so still health. This is local authority, so like councils, 6% from the local council. 1% by the housing organisation, so like that will be like if
Yeah,
you,
I know.
yeah,
Understood that.
yeah, and then other. So it's a real mix of where they sit. Some health, some different sectors.
对啊，所以用这张表，它就是说是谁付钱给 link worker 的嘛。第一个最上面的那个就是刚刚讲的，就是那个医师嘛，公医或家庭医师。然后下面那个 VCFSA 是他们英国的比较特别的用法，就是他们把所有我们台湾叫非营利组织，不管是慈善的、不是慈善的，或是像我们今天早上去看的那个，都叫这个。那所以24%是这些慈善机构或者是非营利组织公益。然后下面这个其实也是 GP， 也是就是刚刚讲的加医支付，只是它是另外一种的原因。然后第三个有一个3个，那个是比较特别，它可能是有一部分是健保，可能有一些特别方案是有3个是健保的这个信托支付的。然后但是他们也很特别，他们乡镇公所也可以付，所以你看一下这边有一个就是那个 NHS Trust 下面那个 Local Authority 就比较是在地的乡镇公所或县市他们自己额外在编的预算。然后再来的话，就是那个有点像我们现在不是有社福机构嘛？不是社福，社宅。那个是社宅，那比较是像社宅机构，所以可能也只有一人少一人，然后其他这样子。对。
就很像农业部有绿色照护。
对啊，如果就是你那个 NHS Trust 有没有就比较像你说那个农业部的绿色照护。
它某的对。
对。
有些偏乡的。
So you will give me the slide, right? So I don't have to. Okay, great, thank you. Yes.
Okay, this is also from the recent survey, and this just shows, so I know that in the dream world, we're referring people to arts and culture and nature-based green activities. In reality, it's mental health support services, financial support, carer support, age-related activities, that's good. But in reality, all of these heritage, these nice things that we like to think is what people are being referred to, actually it's these much more priority areas that we see the most.
But my question is that because of the demand issue or supply issue? Because
demand of these?
Yes.
No, there's plenty. It's plenty. It's because when people go in and they are about to be evicted from their house because they don't have, because they can't pay their rent, actually they need these services more. And someone says, do you want to go to a painting class? like
I see.
it's just like a hierarchy of needs. But the thing is, it's also not either or. So hopefully the link worker would be like, look, you clearly need support with your mental health and your debt, but also there's this class that might be good alongside that. So it's not like you can only make one referral, they can make many.
Okay. So what happened in Taiwan is in the mental health support services, we probably won't be so high, maybe. Okay. I always say maybe because I'm not an expert of this area. But to the financial support or career support or the other that is more like financial related, because in Taiwan we will spread that to the other ministry. So they won't come to this. I know that the link worker try to combine all this as like a one contact window for all, but I'm not sure about the UK because in Taiwan that will be, if that is belong to the different ministry job, it is very hard for me to find the one contact window for the cross-fund.
But they would be referring to other support services. So
they probably will refer to other services, but it's very hard for me to think about the remote career deal with so many. I mean, especially in Taiwan for the financial career, housing support, because all employment support. That will be hard. So currently, at least we actually want to try to combine the green nature-based activity or other cultural activities more for like the mental health and including dementia.
And this is the thing. It's not like this is a very don't get too tied to this because it's very obviously you can have arts that are part of mental health support and age-related activities. This could be singing. It could be anything. So it's just an idea that really, because of that hierarchy of needs, it's not always what we think it is kind of looks like.
对啊，再补充一下，就是说，因为他们的这个制度，因为我刚才讲也是因为是从精神病的需求开始，所以他们刚刚那一张图就显示，其实目前最大宗的还是以那个为主。那当然，其实他们的 link worker，他们的 social prescribing，他们的 social prescribing 跟我们现在想的不太一样的是，他们有非常多的部分是放在就是有点是我们救贫救穷的那个部分。那我们台湾因为救贫救穷是放在另外那个社会局处，不会单一的，就是不会只放在卫福啦。虽然是部都是卫福部啦，可是你到了县市的时候，就是社会局是社会局，卫生局是卫生局，不会说那个什么救贫救穷的会跑到卫生局来，不会，我们就会跑到社会局。然后有的就会去找非营利组织来救，对，这个是他们的制度跟我们那边比较不一样的点，先说明一下。
Okay, and the final slide from this the survey that we did recently, and I can send you all of the slides from the survey. The question that we asked the link workers was, what do you think led to the most positive impact on the patient client? So was it the support from the link worker? Was it the support of meeting other people at the activity? Was it being connected to your local community? Was it the routine of the activity? Was it the type of contact or support? Was it the setting that you were going to, so like the green space or the church or whatever, or was it the extent that, so that we asked them like, what do you think led to the most positive impact? And you can see that they said it was the support from the link worker. So that time that person had to build a relationship, to create a trusted kind of relationship with that person, understand what mattered to them, really listen, and there's lots of kind of like behaviour change that happens with the link worker, and that was the really important part that actually led to the change. It was less about the activity, it was more about the time and the relationship they built with the link worker. So I think this is just to say the link worker is vital to the social prescribing success. It can't happen without the link worker.
It's that's also how I think about that. Yeah, I think that's super important.
Yeah.
But the thing is, it will turn out to be just like in Taiwan, most of the social workers is devalued. They don't understand the value of their job.
Yeah.
So recently in Taiwan, we actually have a case. One of the social workers was be charged criminal punishment because one of her case, the young kids, I think just like under 3, passed away because the problem of the daycare is not that social worker's problem, but somehow I don't know why. I didn't follow the details of the other case. She was charged to have criminal liability for the death of these young kids. So that become like such a big discussion about what is the really liability for a social worker, because they also just like being worker, they got to take care of so many cases. Now how do you ask them to be criminal liable for
sure.
someone's death? Yeah.
Absolutely. It's very difficult, and it's a big thing that we hear as feedback from link workers is how to ensure that they feel supported and well managed, because the link worker is an unusual role in the health system. When they sit in the GP, in primary care or in the hospital setting, wherever the link worker sits, often the clinicians don't really understand the role. They're not so interested. Maybe they make some referrals, but they're not part of the team. And we hear that it's like not so much anymore, and not often. But it's very important that we support them and that they feel as part of the team, and that they're not kind of just taking the caseloads that the GPs don't want.
Yeah.
Okay, so this is just a bit more about the funding and commissioning, because I know you like that bit. So maybe this is the thing you want to look for in that contract that you were referring to. So this is the contract that they were funded through. It's called the Additional Roles Reimbursement Scheme. And that was what the link worker role sounded. It was one of the additional roles, and that was the funding mechanism through which they were funded. Then there's lots of other very dry, boring things about the DES specification. I can send you this, but this is about the kind of contractual side and how they're funded.
Yeah, I think that is also one of the key questions we asked Stripe about how they get the funding, because you think about that, let's say Mrs. Smith went to the GP, right? And the GP find out that what she needs is more like a social support instead of like a medical support. And the GP will refer this Mrs. Smith to a link worker. A link worker now maybe see that maybe you should go to Stripe because under your condition, and then maybe you live close to the park, and it is the better way for you to go there. But the thing is when Mrs. Smith go to Stripe to attend the activities like 6 months, normally it's a 6 months as a rule. I asked her, is there anyone pay for that? Yeah, so the most of the thing is only for some of the people. They actually is under the government program, so they actually can get some pay because that person it is paid by the government, so they can get some reimbursement from the government. That's it, but it is only constitute a very small percentage of the.
I mean that's more than many
other
organizations.
But most of the time they actually still need to get the charity foundations to support them to do such a work.
Yeah. So that is one of the big challenges that we have in England. So we funded the link worker, and everyone had access to a link worker. It was great, but we didn't fund the activity. So that was a big issue. Obviously, there are, I said, 170,000 charity and community groups that existed before social prescribing and will continue to exist. Well, some of them, but we have a strong voluntary and community charity sector, so they, are funded through trusts and foundations and grants and individual giving, and that works in England to some extent, but they're also constantly telling us that they're at risk of having to close because they don't have enough money. and what social prescribing has done. I think that sector has always been like had challenges with fundraising, and that's always existed. But what's happened with social prescribing is that we're sending more people their way. So we're just making, and that's great in some ways, because they want, you know, if you run like an arts group and you only have 2 people coming each week, you want more people to come, but you also want some funding for it. So yeah, we don't have the answer for that. We've looked at lots of different approaches, things like shared investment fund, where you pool money from the public sector, the private sector, and philanthropy all together, and you kind of like leverage. Yeah, we've looked at lots of different models for how to finance these activities, but at the moment that's still a challenge for us.
所以现在的状况就是，就像我们今天早上去那个 Shrine 嘛，他们其实只有一小部分的钱是因为那个来的那个病患，他是有拿到政府补助的，所以当然就有一部分钱他们拿得到，但是大部分 Shrine 的活动还是都是看慈善机构捐钱。然后让他们可以去望这样的 program。那我刚才问他说，对，目前应该是全英国所有的这种社区型的活动，可以让这些社会处方被介绍去的，都是他们只有付钱给 link worker， 但没有付钱给地方提供者，所以会变成说以后，就像我们现在的这个处方签，我们用园艺治疗，如果今天没有拿到外方医院，他们没有申请到那个卫福部的钱。那基本上他们也就没办法继续 run， 因为活动的钱目前是没有支付的。对，他说这个是目前最大的
整合的问题，横向机构的那个整合。
Yeah, so one question is because there are many programs like art, social.
大家都先拿钱再说，人们后面要怎样也不管。
Possible for those like art communities to be sponsored not from NHS. But instead of from like let's say I'm not sure if in UK have like a Ministry of Culture.
Yeah.
Are they able to get some sponsor from that ministry instead of from
Absolutely.
NHS?
So that is how lots of that work is funded. Yeah, through trusts and yeah. So it's called Arts Council England.
我们的长照员是算钱不少的，所以还蛮多人会
Most
愿
of
意
their
做。
work is already
对
funded through
长
them.
照的。
So because they
但他未必能够用这种非正规的什么园艺治疗，他不一定。
Yeah.
So they say they kind of
没有介入啦，我们没有介入那一块长照员的训练。
Refer to them by being workers, so they actually maybe the current base is not enough, their original funding is not enough to support more patients, right?
And I think they have always been doing that work. So there's always been dementia choirs, and there's always been, green gardening groups for people with mental health. That's always existed before social prescribing. But the shift that we're hearing from those groups is that they're saying, why should we have to pay? Why should we have to fundraise? Health, send them here. The health sector should pay because they're sending them. So it's like, yeah, I think it's just a reframing of the responsibility, because those patients are initiated in the health sector. The voluntary sector feels very frustrated that they have to fund the activity.
Yeah, I think so. That's the time to. And also, one of the things, because currently I'm actually wearing many different hats, except as a professor. I also run another association, which actually is training the people who provide these services.
Okay.
The thing is currently they actually do as a commercial part, because it's so hard to get the government's funding, so they got to do the commercial part. So originally, I'm actually super excited about social prescribing if how government actually can fund side of the activity. I won't say all. Let's say if they actually reallocate their health budgets to the mental health more instead of to the other disease, then it is possible for the government to fund some of these community activities if they focus on mental health. But definitely that is an assumption. We don't know yet, because since they are coming, right?
Yeah.
And then my personal guess will be because currently they are under huge pressure about the cancer and then the chronic disease. So they probably
Acute care,
willing to invest some in activities that can solve those disease issues, but they
Yeah.
probably won't go for the mental health because it's the mental health don't belong to the agent who are going to visit you. It's belong to the other agents.
Yeah.
If you understand the politics.
Yeah. No, it's so true, and it's so difficult because so much funding goes to acute care rather than prevention.
Yeah.
And this is, if we could just get 0.1% of the budget.
Yeah. Yes.
Okay, so this is where we are at the moment.
Oh,
so
you have more now than 3,400 because last year before June, I met with the scholars from UK. She told me it's 2,000 new workers.
No.
So wow, so it's actually 3,400.
Yeah.
Wow.
And actually, it's actually more than that because that's only the ones employed by the health system.
Okay, if they're employed by others like local community and others, it's not included.
Yeah.
So my question is, we don't have the certification.
We don't have a database
system.
of link workers.
I mean, there's no need for the certification, training, skills. No. So
There is
who recognizes them as a link worker? They apply for a job.
And in some places it will be called something different to a link worker. It will be called like a community connector.
Yes.
So there is no like formal. You now get the stamp and you're now a link worker. There isn't that. It looks different. There is like standard basic training for these 300, 400 that is an NHS e-learning training. But if you're employed by the local authority, you don't have to do, they will have their own training and it will probably look very similar, but it's not the same.
Okay, so this actually, this number actually is only employed by NHS. And then you see we have a different chart previously actually, which means that we probably have like more than 4,000 maybe?
Yeah.
Right? Okay.
Yeah.
But how do the 9.5 millions come from?
So that is the 9.5.
And then just pay for the GP.
That is where a GP has made 9.5 referrals to a link worker.
Oh, referrals.
Yeah.
Oh, that's huge.
Yeah.
That's crazy.
Yeah.
The number is.
Yeah.
OK， 然后大家看一下，那边有一个950万人次哦，是加一把病人推荐给 link worker。可是他们的，你看那个3400是有拿到他们健保局支付给 GP 钱的。那刚刚不是说有些 link worker 是慈善机构请的，或者是在地的乡镇工作请的，就不在这3400的里面。哦，他这3400是因为是有那个健保有付的，所以他们算得出人。啊，如果不是健保付的，他们算不出来。所以如果用总数来算，有可能有4000人现在。对，但是950万人次，而且是从2019年到现在，包含疫情，这个数字也实在是太可怕了。对 ，It's a huge number.
It's huge, yeah. So not all of those people will take up they won't want, but that's how many GPs have.
Yeah.
意思是说他都推给他，他是信任他还是推给他？
Okay, so interesting question. You see now we have like a 9.5 million consultation, right? So in Taiwan, okay, this is Taiwan's case. I'm not sure here in UK. In Taiwan's case, sometimes the GP thinks, oh, this patient comes here too often.
Yeah,
and,
exactly.
And then they should go to somewhere else.
Frequent flyers.
Yes. The same.
Yeah. So this is something that it's a risk.
人球就是那个，对 ，GP 不想看的就推到link worker那边去了。
Yeah. But often, actually, social prescribing is good for them.
Yeah.
Because actually, they just want connection.
Someone to talk to.
And then maybe the link worker can help them find a group and something else. And actually, specifically for those people, high usage or high usage patients. Social prescribing is particularly effective. So we have a good paper on how actually for people like that, it's like really, really effective at getting them to not go so much.
很难，都一样。
And this last point, so 23% people of the percentage of the public now understand the term social prescribing, and 97% of GPs like it, which is really, it hasn't always been 97%. That's
especially for the doctors.
Yeah,
They are
exactly.
very picky about it.
所以大家很容易生病嘛，感觉上什么病啊，对不对？
不是，应该是说他刚才讲的
各种身心灵
没有，他刚才的意思是说，通常你推过去还是会被推回来，有可能啊。可是蛮明显的就是，目前透过 link worker 转介过去以后，处理完以后，那些医师们满意度都很高啦，所以医师的满意度有到97%啊。那这个
他是信任嘛，
对
也有推，也有信任。
所以基本上这个也很难啊，因为你知道台湾的医师会对一个这个所谓他们搞不清楚 link worker 是干嘛的，就满意度要到97%，我觉得不可能，有67%，我觉得我已经很了不起。就他们这里可以到97%，我觉得也很不容易。而且重点是，刚刚已经确认过没有考试，没有证照。没有认证，
所以医生不会信任啊。
他顶多只是说到 NHS 上面有一些网络上的课程你上过就可以了。对。
So this is just to say this point is exactly what you're talking about. So high, what do you call them? High service, frequent service users. And we saw significant. This is a paper, and no, it's not here, but I'll give you a copy. And it was just around looking at the impact that social prescribing was having on the health system. So was it reducing impact? Was it reducing the load for the GPs and emergency services? And it showed that it was significantly doing that.
But I don't understand how they link it to the emergency services because most of the time the emergency services should be like heart attack, the car accident, something like that. Is there something else so that they can use? I'm a little bit confused about that.
No, but I don't know if you have this in Taiwan, but I don't know what percentage, but maybe like, I don't know what percentage, but maybe something like 50% of calls to 9R emergency services is mental health. Yeah, very bad. People are so naughty. They just call, so it's a major resource issue for emergency services.
我想问一下，我们台湾有那种就是半夜莫名其妙因为精神疾病，然后就打电话叫救护车，很多吗？
多我不晓得，
有到50%，怎么可能？好像如果这样早就新闻报到那边去，
没有，他护理师问他护理师，
夜间的紧急支援专线。
We do have the similar behavior, but the percentage definitely will be much lower.
I don't know what percentage.
Yeah, but I know that
这个跟国情会有关系。我们有夜市，我们有夜生活，他们比较没有，会不会是有关系？不知道。
Oh, because another thing is that she said because we actually in Taiwan we actually have a lot of like business operation until midnight. So you still have a lot of things. So you have never been to Taiwan, right? No. If you come, you want 24 hours. Wow. You go to 7-Eleven. 7-Eleven actually was 24 hours.
Yes.
It's not 7 to 11.
So
So we actually do have a lot of places. If you have nowhere to go, you want to talk to someone, then you just go to those night market. You go to the we call it convenience store, which is 24 hours.
Yeah.
So sometimes, for example, I myself, sometimes I actually went to the park to do the jogging for like 11 p.m. that morning. So after that, I will go to the convenience store. We call Family Mart or 7-Eleven. And then I saw some people actually are quite often go to those shops after 11 or even 12. And then they talk to the counter because they have someone to talk to. You just go to buy the milk.
I mean, that's good in some ways,
Yeah, so that's the thing.
因为我们很小啦，我们很近 close， 然后他们很
that's
远。
in the city. But that's in the city. In the cities, it's very, in Taipei, if you talk to someone that you need to take 5 minutes walk to a convenience store,
Yeah.
the people will think you live a place far away.
Yeah,
Okay.
Yeah.
But because to me
Yeah.
myself, I can walk in 2 minutes,
Yeah.
three shops.
Wow.
Yeah, you know, so that's
Wow.
why.
Yeah.
It's different. It's
Yeah.
different. Yeah.
Okay. Okay, so I will send you these, but this is a bit boring. It's
Yeah,
just
boring.
quite technical. So this again is just talking about
10 years plan.
yeah, exactly. So the 3 key shifts that were mentioned in the 10-year plan was the shift from hospital to community, from sickness to prevention, and from analog to digital.
Yes. It's all, especially in the age of AI.
Yeah.
Everyone is talking about digital. Yeah.
So we like to say that social prescribing is perfect for all 3. It does all 3.
Yeah, but how about the digital part? Because it's so hard to imagine like the link workers' job can be easier even with the support of AI because they actually quite human touch and also engage with the community.
Yeah, it's tricky because, and we are hearing this like more and more, but I think is that the whole like ethos of social prescribing is based around that personalized care approach and that relationship with the link worker.
Yeah.
And so it can't be an app.
Yeah.
It can't be, sometimes they do calls and like they do, it doesn't have to be face to face.
Yes.
Sometimes they might
You
meet
got
face
to
to face
have
and then do
human
calls.
touch.
Yeah, it's got to have human touch,
Yeah.
otherwise it's not as effective.
Yeah.
Okay, so this is just to show how many sectors and partners
They
are involved.
working on this, right?
Sorry.
Working on the social prescribing or working on the
No, just from government. So this is the Department for Health and Department for Health. Then we have like Department for Environment, who sponsored our green social prescribing program. Then we have Sport England, who's like the
Yeah.
government agency for sport, so lots of physical activity. Then we have the Department for Work and Pensions. So they have just done a pilot program around fit notes. So like fit notes, like a note that a doctor writes you to say that you can't work. Yeah. Department for Education, Children and Young People. Ministry of Justice, so like people coming out of prisons and rehabilitation. Department for Transport, so that might be like active travel pilots and stuff like that. Are like Culture and Arts department and another Arts Council department, and then ALSA, the National Academy, and NHS England. So there's so many different parts of government involved in social prescribing. Just to kind of map it out. This was
Yeah, so the agency that is going to visit you 3 weeks from now.
Yeah.
I think their role is a little bit like Department of Health.
Okay.
But they don't include in social care because the social care
yeah.
is belong to the other agency in Taiwan.
Yeah.
So will be quite interesting to see how they think about link worker because that's the problem that they probably will want to move this to most of the jobs should be done by the social worker instead of them because they go in charge of the social care part. Yeah.
Yeah, that's useful to know.
Yeah.
Yeah.
所以我们时间
They didn't know.
时间有点差不多。
I can skip over this, but this is just a bit more detail on the types of programs that some of those departments do. So the work and pensions, and then the culture, media and sport, and then the environment one.
Yes.
So they're all involved in social prescribing. We have done a lot of work recently around the faith sector. So this feels like a really sort of untapped opportunity for social prescribing.
Including all kinds.
All kinds of religions, yeah, exactly. So we've done lots of work bringing lots of different faith leaders together and trying to kind of tap into those incredible community assets that already exist. Because Though, yeah, there's,
Yeah, I know. So just let you know the fact because they are coming. We actually have one of these faith community, the largest one in Taiwan called Shiji. And Shiji actually have the operation around the world, not just in Taiwan.
Can I write this down?
Yes, yes. So whenever there is any, I actually can give you their website. 记得英文努力。
你找网站会不会快一点？
对。
实际的网站会不会快一点？
Yeah. So I will show you the more details
Yeah.
what they have done. But because of this foundation, they are so powerful and useful. So I would say, 哇，他真的这真用词
有，就是实际对。
So this is a Buddhism.
Okay.
Yeah. And their operation it is not just in Taiwan but worldwide. But because whenever there is a big disaster come, for example earthquake, tsunami, and so they actually will be the first always and from the start. So that's
maybe
why.
they're a good
And
foundation
then they
to work
also
with.
do a lot of community work. Previously earlier stage, but now because the ages differences. So you actually also when you show this to them, you actually can
Okay,
talk about
thank you.
it.
This is very useful. So yeah, again, and I can send you, we've done a recent report on faith and about the opportunities that there are there to work with different communities. This is just some of the work we do with clinical leaders. So in England we have the Royal College of General Practitioners and we have the Royal College of Nurses and the Royal College of everything, so occupational therapists. Every different role has its own one. So we do lots of work with all of those different kind of parts of the health system to make sure that there's buy-in across all those different parts. We also do a lot of work with the press, so just getting all the positive news stories out there. And there's ever increasing. In the early days, there weren't many stories like this. Now there's loads every day.
Yeah, but my question is because you mean that this is actually broadcast by national academic for social prescribing, so the media actually buy in, or actually if it's any communities or like the link workers, they can share because in Taiwan sometimes they will say, oh, this is government they trust more, so the media will report more. But when it comes to is a non-profit organization or charity program, they just say, oh, you just want the name of that. So I just want to,
interesting.
Yeah. So we to know that this awareness campaign is all done by yours.
I think it's probably a combination of all of it, but I think the evidence base from academics and investment from like Department of Health and NHS is a big factor.
Okay.
It legitimizes it. But another big factor is the international work, because if we can say that, so it, like obviously we can say like, look, it's working, it's going great. But actually, all of our international work is really important to legitimize what we're doing at home. If we can say, look, other countries are coming to the UK to learn about social prescribing, it's going really well here. You have to keep funding it. That's really valuable for us domestically if we can talk about what's happening internationally.
Yeah, because they actually have another appointment after 5. So
5.
Yeah. So
Okay.
one more question is regarding about this is talking about the evidence from the academic. Is this sponsored by NHS from you or from any others? I mean, you got to have the evidence to prove the social prescribing actually work for like mental health or So
is the
for the
evidence?
Yes. Research.
I mean, usually like universities, but who would be paying for it? Like a real mix. It's not really the NHS, no. Other sometimes the NHS, but not really.
Okay.
Other partners. Often like those other government agencies. So
Want to prove that
the Environment Agency
want to bring the green.
exactly.
And
They
so
funded
that is
a
sponsored.
huge program and an arts council will fund a big program. So maybe like that, but also maybe independent charity, like big charities like Alzheimer's UK might fund. Well, they have just funded a big music and dementia program that I work on. So yeah, a mixture. Okay, we'll leave it there because you have to go. Yeah. There's a few, but let me just have a look. Oh, what's my mouse now? So I think these are kind of some of the evidence reviews that we've done. So some on like the economic impact, some on different kind of like health outcomes, some on working with ethnic minority groups. So basically we produce lots of, we don't carry out research ourselves, but we produce lots of like rapid reviews on different themes that we know are useful.
So is that the public available for all
Yeah.
this research?
All on our website. Yeah, so I can send you. Yeah. And then some of our international work. So I just show you here. So this is some of our these are all countries that are part of our International Social Prescribing Collaborative, and we meet every 6 weeks online, and it's a network of social prescribing leaders from different countries. You'd be very welcome to join. We already have some members from Taiwan.
I see Taiwan from
Yeah.
there.
Yeah, it's really great, and we come together and we share knowledge and best practice and sort of promote growth of social prescribing. This one is useful, and then it's over. So this just shows how the link worker role looks different in different countries. So in Canada they call it community connector. In the US it's a health lead advocate. In India it's an ASHA worker. In the Netherlands it's a well-being coach. In Japan it's a Shikatrushian. So it's different names for the same thing, and it doesn't really matter what you call it because it's all about the function of the role. And they all take the same approach. And it doesn't really matter if it's an upskilled social worker or if it's, in some countries, actually, the GP and the nurses and the receptionist takes on the link working approach. So it can be, there's a huge variety in how it's implemented in different health systems.
Yeah. So currently in Taiwan, because we actually think this is come from UK system, so we use the lead workers
Okay.
name on that currently, and then we translate it to Chinese.
Nice.
Yeah.
Okay.
Okay, thank
Want to change
Sure.
the gift?
Yeah.
They actually do provide the gift to you,
That's
and
very
then
kind.
you also
那个，先拿。
Thank you.
先
Very,
先
very
送礼，
kind.
先送，你要站在哪里呢？
哪边？